In this presentation, we're going to talk about quantitative design. Overall, we'll cover about 6 topics in this discussion. We'll talk about experimental designs, quasi-experimental designs, pre-experimental designs, non-experimental designs, sample size guidelines, and how to choose a correct quantitative design. There are 6 basic criteria for classic experimental design. We'll have a pretest and a post-test. So we're going to test the participants before and after an intervention or a treatment. We'll have an experimental and a control group. So somebody's going to get the treatment and somebody's going to get the dummy treatment or no treatment at all. We'll have random selection of participants out of the population. So we're randomly selecting people from a population. And then we're going to have random assignment. So our participants in our study are going to be randomly assigned to the experimental or the control group. A quasi-experimental design is a little bit more common. So here we have participants that are not necessarily randomly selected. So you're going to look at purposive sampling in some manner. If there is a control group that is used, participants are not randomly assigned. So you're often looking at purposive sampling, and then they're all going to be within the experimental group. But there is a pretest and a post-test after an intervention or a program. So I like to think about this, a very common example is somebody with a medical condition that you're testing out a new drug or intervention with, right? So you're not necessarily going to give somebody medicine if they don't have a certain ailment. You're going to just look at people that have that ailment and provide them the intervention or drug or whatever it may be. And you're going to do a pretest and a post-test to see the effects of that. Sometimes you want to look at matching your control groups, and there's 3 different ways you can look at that. You can go with an intact group. This is where the second group matches the first one. So using 2 nursing homes from the same nursing home chain. You can look at individuals where each group member in the group individually matches the group member from the other group. So individual from group A matches individual from group 2. So if we're looking at the nursing home, we're going to match residents on length of stay. So the first resident's been there for 6 months. So the similar resident in group 2 is going to be there for 6 months. And then we're going to look at aggregate. So we're looking at an overall average of pretest scores and how they match. So we got somebody in group 1 and group 2. So everybody in group 1 averaged 50% on the pretest. So everybody in group 2 is going to average a 50% on their post or on the pretest as well. Another common design is pre-experimental design. So we have no random selection, no random assignment, no pretest, and no control group. So we're looking at purposive sampling, right? So we're looking at specific individuals, inviting them to participate in our study, giving them a treatment, and then doing a post-test to see how it affects the condition or whatever we're looking at. So the big thing to think about here is there's no pretest. So we're not testing the individuals before. We're giving them a treatment or providing a program, and we're looking at the effects afterwards. And there's no control group. Everybody that we invite to participate is participating in the treatment or a program. And then another one is non-experimental designs. So we're not providing a treatment, an intervention, or a program at all. Basically, we're studying the respondents exactly as they are. And so we can look at this with survey design or ex post facto design. But again, we are not doing any kind of treatment, intervention, or program. We're just looking at people as they are. Think of it as a snapshot, if you will. So with survey design, we can look at it in 3 different ways. We can do a cross-sectional study, which we're going to study age differences of some kind of thing. So if we're looking at ice cream flavor preferences, right? We're going to look at how do people of different ages prefer their ice cream flavor. Younger people prefer this type of flavor, and as they age, they prefer different flavors, right? And that's going to be a one-time thing. So people right now that are 20 prefer vanilla, people at 30 are chocolate, and people at 40 are strawberry, and we want to talk about why. Then we can do a longitudinal study, which we're going to study one person or a couple of people, and we're going to test their flavor preferences across their age. So we'll ask them when they're 20 what their favorite ice cream flavor is. We'll ask the same person when they're 30, and ask that exact same person when they're 40, and so on. And we're going to just gauge what kind of ice cream flavors they like across their lifespan. So we're looking at their age changing for the specific individuals. Then we look at time lag. So we're looking at a group of individuals, and we're going to study their flavor preferences. So we're doing it now. So we're looking at 20, 30, and 40-year-olds right now and what their flavors are. And then we're going to ask those same people as they age what they're. So we're going to go back, and the people that were 20, maybe now they're 30, and we're going to survey them again. And when they're 40, we're going to survey them again. And then the people that were 30, we're going to do it 40 and 50. And people that are 40, we're going to do 50 and 60, like that. So we're really combining cross-sectional and longitudinal surveys, and that's a time lag survey. With ex post facto design, it's also known as a correlational design. There's not a focus on a specific treatment, intervention, or program activity. And we're really looking at how one or more independent variables affects a dependent variable. So if we're looking at the flavor of ice cream, right, we're not necessarily just looking at age in this regard. So this is, again, it's going to be more like a snapshot. We're asking how old you are and how that affects your ice cream flavor preferences. But then we're going to gather other information that may affect it as well. Things like where you're at, your age, your education level, your religious affiliation, different things that we may think may affect the ice cream preferences, right? And we're going to try to understand how those independent variables affects that dependent variable or is related to it in some kind of manner. Again, we're not looking at age differences only or anything like that. We're not looking at how people mature as how people's flavor matures as they mature in age. We're looking at a set or a variety of variables and how it affects the dependent variable, which is a flavor preference. Okay, so let's look at an example with heat and aggression in baseball. So basically what we're thinking is hotter temperatures affect a pitcher. So we've noticed that when games are played in degrees of 90 or better, the batters have a greater chance of getting hit for whatever reason. We also know from the vascular theory of emotional efference that brain temperatures trigger heat aggression. So after we found out that this is true, we linked it with our games that are played at greater than 90 degrees, batters have a greater chance of getting hit. We want to come up with a solution to this issue, right? Basically, we're going to play games at night where the temperature is naturally cooler, or we're going to play inside stadiums where we can do temperature control. So it's ex post facto because we're looking at we looked at a variety of factors that may affect the batters getting hit by the ball, right? Then we've only looking at the outcome. We didn't do a pretest to gauge aggression or anything like that. So we're looking at a variety of factors, and there's no pretest or anything like that. Does that make sense? So let's take a couple of examples here. We'll pick a couple from this group, and then you can look at this as we go through it. And we're going to try to identify a suitable quantitative design. Our first scenario is we want to find out if participation in a 10-week aerobics class affects body image. And because we have one static group, right, that there's no control group, so to speak, and we're looking at a post-test only, we're going to look at pre-experimental design. So we've got one group, and we're going to see how that affects the body image. Next, we'll go to number 3, which is assess how daily participation in a soccer class held during a 7-day camp affects kicking and defensive skills. So again, we have one group, and we have a pre-test and a post-test, right? So we don't have necessarily a control group. We only have an experimental group, and we're doing a pre-test and a post-test to gauge their defensive skills. So it's going to be pre-experimental. Number 5, we're going to evaluate the effectiveness of a swim instruction program for 5-year-olds. So again, we're looking at just a post-test of just the one group of 5-year-olds, and so that's going to be pre-experimental design. Let's go to number 6. Identify factors affecting hiking satisfaction. So it's going to be a non-experimental ex post facto design because we were only looking at outcomes, right? So we're looking at hiking satisfaction. We're not doing a pretest, and we're looking at a variety of factors that may affect it. So we're not just looking at one intervention and seeing what happens. So we're going to try to identify many variables and see how those variables affect hiking satisfaction as a dependent variable. I'll give you a couple of minutes to really look at the other ones here, or you can pause the video.